All right. All right, it's showtime. We are live. This is the voice and the face of Dr. Olabintan. I'm the CEO and co-founder of Livingspring Family Medical Center in Mansfield, Texas, where we help our patients live long and well because we believe the quality of life is just as important as the quantity of life. Try to fix my head a little bit. Okay. Today we're going to be having topics in line with what we're about. And the topic today is Doc, I'm pregnant. What should I expect at my OB visit? And for those of you who are watching for the first time, please hashtag live if you're watching live, and then hashtag replay if you're watching replay. But one of this, the reason why we're having this conversation is because as a primary care doctor, sometimes I'm the one who we confirm that, yay, you're pregnant, woo, and then we talk, referring you to your OB-GYN to, start your prenatal care, and so I get a lot of questions. What should I expect? What should I do? And so we thought that this would be a good topic to discuss. And I'm very excited and honored to have Dr. Kenosha Gleaton join us. She's backstage. And if you're watching live, please give her a warm welcome in the chat. And of course, if you have guests that could use this topic, kindly tag them in the comment section or just forward this link to them. So I'm going to bring her on and we'll go right ahead. Okay. All right, Dr. Kenosha, are you ready?
Yes.
All right. Welcome, welcome, welcome. How are you doing, Doc?
I'm doing great. Thank you for having me on, Tolu.
Oh, my pleasure, my pleasure. And thank you for taking time out of your busy schedule to do this with us. Now, that being said, we're going to go straight to the topic. Could you kindly introduce yourself, Doc? Who are you and what do you do?
Yes, so I am Dr. Kenosha Gleaton. I am a board certified OBGYN. I practice in Charleston, South Carolina. And I recently, well, not recently, I guess 2.5 years ago, opened a private practice called the FE Center, where we focus on women's wellness. So we do pregnancy, GYN, and we also focus on the spiritual well-being, physical as well as emotional well-being of women. And so we try to offer a comprehensive experience at our center. I'm also the medical advisor of Natalist, which is a prenatal / fertility company that sells products, but basically focuses on making sure that women have scientifically backed information for their pregnancy.
Awesome, awesome. I love what you do. I love that you do all the things. Doc, inquiring minds want to know, why do you do what you do? Is there a story behind why you chose to go into this field?
It was actually Tolu by default because I knew for sure from the age of 8, actually, that I was going to be the world's best pediatrician. And I loved, loved, loved playing with kids as a child. But I realized that when I went to medical school, playing with kids and treating sick kids was a lot different. So I quickly realized that I didn't enjoy the element of not being able to understand what was always wrong, because kids often, when they're really sick, they can't really tell you exactly what's wrong. I also did not like having two patients, because you're treating the child as well as the parent. When you are in pediatrics. Now I also treat two patients, right? I'm treating the fetus and the mom, but the fetus can't talk, so I can kind of be okay without having to communicate with the fetus and just focus on the mom. So
That is so funny. I went to med school thinking peds too, but then doing the rotations, they would bite, they would kick, and I'm like, it's not like play with a kid. It's different. Oh my goodness, that's so funny.
I get sick and I get scared, so I don't want all that. Yeah.
All right. I knew you were going to downplay some of your achievements, but I got to say, Dr. Gleaton, you've done quite a lot. I'm impressed with your passion, that you love to serve. I love that you've traveled. You worked in South Africa, you worked in Costa Rica, and you're big about women's care. And I wanted to highlight that you were recently named a healthcare hero by the Charleston Regional Business Journal. Okay, so I wanted to shout you out because what you're doing is making an impact, and so thank you for what you do, Doc. Um, Now that
Yeah.
being said, my next question to you is this: someone is just got pregnant, found out they're pregnant, confirmation, excited, and they're asking, well, how often should I schedule prenatal visits, or when is the best time, quote unquote? And I know this is a loaded question, but when is the best time to start your prenatal visit? What would you say, Doc?
Yeah. So most OB practices want to see you between and 9 weeks of pregnancy. So that does not mean you should wait until you're 6 to 9 weeks to call the office, because most offices are fairly busy, and UOB visits are typically 30-minute visits. So there has to be some time allocated for that. So I encourage patients to call when they first have a positive pregnancy test. And then that gives us 4 to 6 weeks to get them, in the office. So call when you first are pregnant. That is also a good time to kind of schedule like a little nurse visit where you go over your medications and make sure there's nothing that needs to happen or no meds that need to be stopped before you ever have your first visit. So it's good to go ahead and get that appointment scheduled.
Awesome. Awesome. All right. So the next question is for someone who's a little apprehensive, first time pregnant, they're about 7 weeks, they have an appointment. What should they expect the first visit? How should they prepare? Like what would you say to that person?
Yeah, I try to encourage patients not to stress about the first visit. I have patients who come and they have a list like this long. They want to ask everything from who's going to be in the delivery room to postpartum depression, things that we really have a long time to kind of go through and tease out and kind of dissect further. But that
Mhm.
first visit is supposed to be so exciting. Like, this is often the first time you're seeing your baby, you're getting your ultrasound, usually a family member is there, a support person, and it's just really an exciting time. And we want to focus on actually establishing the viability of the pregnancy, just making sure that the baby looks good. We're establishing your due date and making sure that all those things are well aligned. And so at the end of the day, you shouldn't stress about it. You can certainly come in with a few questions pertaining to, like, first trimester things, but you're going to be seeing your OBGYN a ton. Sometimes I see my patients more than I see my husband, right? So you see us a lot. And so you're going to have lots of time. And so just take it all in, be present in the moment, enjoy seeing your baby, and just understanding that if you chose a reputable OBGYN, which most of us are board certified and reputable, they are going to make sure that all those things need to happen and those check boxes are checked.
Okay. Awesome. 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 So now we talked about coming early as soon as pregnancy test is confirmed, so you can have time to plan those visits. But what tests and screenings are typically done during your prenatal visits?
Yep. So we like to break these down by trimester, Tolu. So in the first trimester, of course, we want to get the panel of new OB blood work. And this basically is testing for things that typically don't change. So we're testing your blood type, and we're checking to make sure that you don't have antibodies in your blood. And we're checking for infectious diseases such as hepatitis and syphilis and HIV. And we're checking for vaccination status, whether you've been vaccinated and your rubella and things like that. So there's a lot of, like, probably about 9 to 10 labs that go along with the prenatal panel. Depending upon your history, if you have a history of other chronic illnesses, we might check other things such as protein in your urine. We might check your thyroid, your vitamin D status. But basically, at that first prenatal visit, we often get just basic prenatal labs. And then a little towards the end or further into the first trimester, we do genetic screening of the fetus, and this is optional. However, we do recommend, if you're over 35, to get that testing, just so that we can ensure you that there's not a higher risk of a genetic abnormality. That's also known as, I call it the GG test, because it's genetics and gender, and most people just know about the gender, so they're wanting to know the gender. And amazingly, you can find out that gender test as early as 9 weeks. So that's basically the composite of the 12-week visit or the first trimester screening. Then later in screening, we do screen for more things that are not baseline, but more related to pregnancy-induced conditions. So we screen for gestational hypertension, and that's just high blood pressure in pregnancy. We screen for gestational diabetes. So anything that has gestational in it, that means pregnancy-induced. So we screen for gestational diabetes. We screen for anemia, so pregnancy-induced anemia. We can often see that, and it's usually related to iron deficiency. So those are things that are screened for later. And then as you are near term and nearing delivery, one of the main tests we screen for is group B strep, and that's just basically a bacteria that can affect the delivery of the infant. And if you screen positive, we just give you a simple antibiotic in your IV once you're in labor.
Okay, so essentially quite a couple of tests to do depending on what trimester you're in. And essentially
Right.
you need blood tests, urine tests. So some people get a little apprehensive about blood draws, but yes, you'll be required to do some blood tests just to make sure that you and baby are doing well. Um,
Absolutely.
Now, For the person who's asking, well, am I going to get like ultrasound so I can see the baby every time I come? I've had patients ask that, like I would like to see the baby, make sure the baby is okay. What would you say? What would you say to that, doc?
Yeah, there are certain indications for ultrasounds, and we try to follow strict policies in terms of that. But a standard pregnancy, a standard low risk pregnancy, will receive an ultrasound the first visit to confirm the pregnancy and the due date. And then typically you will get a genetic ultrasound at about 12 weeks, so at the end of the first trimester. And then you'll get an anatomy ultrasound at 20 weeks, which is about 5 months of pregnancy. And that is like an hour-long ultrasound that is basically a surveillance of all the anatomic systems of the baby. So you want to make sure that the heart and the brain and the kidneys, all those things look like they're functioning and they are present and, functioning as they should. And then, so those are the three standard ultrasounds that almost every pregnant lady will get. And then afterwards, if you have high risk conditions, such as the baby's growing too big or too small, or you develop diabetes or high blood pressure, or your placenta has an abnormality. So there are various high risk conditions that will cause you to get growth ultrasounds after the 20-week anatomy ultrasound. But if everything is perfect, typically that 20-week anatomy ultrasound is the last one, unless you have an indication.
Okay. Now, what are your thoughts about preparation for? You mentioned something earlier. I'm going to ask this question. You mentioned that sometimes people are inquiring about who would be there for my delivery, and I kind of want us to touch on this because, like, how do you help patients adjust their expectations with that? Because we know that delivery can happen anytime. And how do you kind of coach your patients to prepare for whoever is going to deliver that baby?
So are you saying who's going to deliver the baby or who can
deliver the baby? Because that's one of the, you brought it up earlier, and it's off topic, but I wanted to address it because a lot of times, even having conversations with patients, they're like, I want to see the doctor who I saw deliver my baby. Is that something that, sometimes that's not realistic. And I've had some of those, I have to have some of those tough conversations with patients and say, you could deliver at 2 a.m., you could deliver at 2 p.m. It's hard to tell when, but there's a team at work to make sure whatever time you deliver that you're good. How do you prep your patients for that?
Yeah, I think it's important to set the proper expectations early in pregnancy. So it's all about proper expectations. And so I learned early as a young doctor not to make promises because often you cannot keep those promises and then you ultimately let the patient down. And so I think most doctors, in the United States, in terms of their call coverage, that information is available early on. And I think there are different models. So basically, I tell patients to choose a practice that has a model that is aligned with your birthing goals, right? So if you absolutely know that you want one physician or one midwife to deliver your baby, then you should probably choose a practice that has like those limitations. And usually, if you choose a practice that has one or two doctors, they are limiting the amount of OB patients that they accept so that they can try to be present for all of those deliveries. But if you choose a practice where there are 5 to 10 to 15 doctors, then that's going to be a call rotation. And that allows doctors to have more time off from the hospital. However, it's not all that often that you will be guaranteed to get your doctor unless you schedule an induction, which sometimes still can end up being a different doctor. So it just depends on that call rotation or that schedule. So I think you have to determine what's most important to you. And at the end of the day, I tell patients that I want to be available for you, but I only want to be at my best. So you don't want me if I'm sleep deprived and I've been up for 72 hours because I'm more mistake prone. And I think all humans are at that point. And so I think patients get a better understanding of that. And then I also help patients understand that during the labor process, you do not need your doctor there the entire time, right? If you're a low risk pregnancy, things are going well and your baby looks good, then often doctors elect to come at the most important part of that pushing and delivering phase. And that allows them to be present for multiple deliveries and multiple patients. And so I think that's important to understand as well.
Thank you for breaking that down. It's very, very helpful. You want a well-rested OB to deliver you, whoever that person is going to be. And so it takes a team approach when you're, being seen throughout your pregnancy. And you can, I like how you explain find a practice that aligns with your goals and preferences, but understand the benefit of both,
Right.
both systems. So awesome, awesome. Now, my next question is this: I have patients who ask, "Well, now I'm pregnant, and every bottle I see on the when I go for to buy like a medication, Tylenol, I have a headache, says, "Oh, if you're pregnant, do not use." What do you typically say, generally speaking, to patients who are pregnant who are like, "Well, I can't call you for everything. I had a little cough. Are there things I could take? My back hurts a little bit from the stretching from pregnancy. Are there things I could take?" What would you say to that, doc?
So I encourage everyone to kind of reach out to their doctor, but most practices will have like a standing medication list that's safe in pregnancy. So that allows you to have some autonomy in choosing which medicine you take and which one works best for you, because there are many safe medications in pregnancy, despite what my patients often think. They don't want to take anything and they will suffer right on through and try not to take medications. But there are lots of medications that are safe, but they're usually outlined in the packet that your OBGYN will give you. And so I think if you ever have a question, you should always call and make sure that it's safe, and don't take anything if you're unclear. Often I get patients too who go to the ER and the ER doc will give them a medication and then they call me and say, "Hey, you know what? This doctor gave me a medicine. I want to make sure it's safe." And I think that's fine too. There's safety in numbers. And so I certainly don't mind patients calling, asking, and verifying that the medication that they're about to take is safe.
Awesome. I love that. I love that. They can call and confirm. They can ask questions. Now, that being said, I was going to ask this question next. What should I do? A patient asking, what should I do if I experience any complications or concerns during the pregnancy? You already touched on it, but after hours.
Yeah, and I think that's important too, because I'll find patients are going to a practice and even come into my practice and they have no idea what they should do. Should they just go to the hospital? Should they call their doctor? If they do call their doctor, is it the office number? Is it a different after hours number? And these questions should be clearly outlined, so that you know exactly what to do. You don't want to wait until the hurricane happens to try to pack your bags. You want to make sure that you know exactly what to do and have these numbers readily accessible. I will say that I think most practices keep the number the same so that if at any point you call that one number, you're going to get either the office or after hours and you don't have to remember two numbers. And so I think that's important. But also just kind of knowing how your doctor operates and how your practice operates. Do they want you? Many hospitals have like an OBGYN or an OBER, or an emergency department for pregnant women. It's just for pregnant women. And if you have any after hours and emergency situation, you can just go there and they will treat you and they will inform your doctor. So many patients just go directly to the OBER, but most doctors are happy to kind of take those phone calls at night as well and help guide and help you determine if you should go to the OBER. So just kind of figure out what is the policy for your practice, so that you know what to do when you need it.
Okay, awesome. And now my last question will be this. What do you tell patients to expect, like for those who are closer to delivery? Okay, doc, I'm going in. Are we going to the labor and delivery? Some people may not have gone to take a tour of the place, so they're not sure where they're like what it's going to be like. But what would you say to them in preparation for the day of the labor and delivery visit?
So I love preparedness. I feel that preparedness reduces anxiety, it reduces, and it can reduce complications on the doctor's part as well as on the patient's part. So I would say I do encourage a tour so that you kind of have been there before and you know where to go, because you don't want your water to have broken and you're contracting every 3 minutes and you're trying to find out which entrance is proper for the hospital. And you're having to go drive around the hospital and figure it out, or you're trying to find parking and all those sorts of things. And if it happens at night, then it's even that element as well. So I would say go to the hospital beforehand, even if they don't provide official tours. Most hospitals are now doing tours in person again, but even if there's not an official tour, just going and knowing, where do I enter, where do I go, where's labor and delivery, which floor it's on, so that you're not having those barriers and increasing, like labor in general, it can be scary, especially for your first baby, and you don't want to have those barriers and have the extra anxiety associated with not being prepared.
I love it. Find out about where the labor and delivery floor is. That's very, very important. It can be pretty awkward otherwise. So preparedness is key. Thank you so
Absolutely.
much, Doc, for all of this. A lot of information to go back and dig through. One more last question. I said that before, but are there resources? People Google a lot of things. Of course, talking to your doctor. If you're in the if you're near Dr. Gleaton's area, you can reach out to her and maybe sign up to be one of our patients as well. But for those who are saying, where can I go to find resources or support groups for pregnant women, so that way I know, that the information I'm getting is relatively good. Do you have any suggestions? I don't believe in blindly Googling information.
Yeah, so definitely most local hospitals will have like pregnancy support groups that they are linked to in your area. So you could definitely reach out to your hospital, go to the women's department on your hospital website, and often they will have like certain areas or certain support groups that are in your local area. I know often too the La Leche League, they are breastfeeding organization that also has like prenatal and postnatal support groups as well. Many doula organizations also have those. And then if I could, I would recommend, if you have the availability, to go to a OBGYN practice that has a centering program. So centering for me is very important because it's the only mode of prenatal care that we know that has reduced bad outcomes. So we have reduced like just in general, maternal morbidity and mortality in terms of postpartum depression rates are lower, the suicide rates are lower, preterm birth is lower, low birth weight is lower, breastfeeding rates are higher, patient satisfaction is higher. So it is a wonderful program where you basically already have a support group built into your prenatal care. So these women come, and instead of meeting the doctor or the provider one-on-one, they go to, basically it takes the care out of the closed exam room and it brings it into an open circle where you're paired with about 5 other pregnant women who share the due date, the same due date or the due month. And you guys go through your pregnancy journey together. So that becomes your tribe. And so certainly those women have better support. So their outcomes are better simply because they have like a girlfriend or a tribe to call on when they have questions or concerns.
I love that.
Yeah, it's great.
I love that. I love that. You have that at your center?
I do. That's why my office is called the Epicenter, because we focus on centering group prenatal care
Okay.
because of the higher risk for many of our patients. So it's a wonderful
Yes,
program.
yes, 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 yes. The rate in blacks is ridiculous. So this wow, you created this, mind blown. You created a tribe around pregnancy. Are you kidding me? I don't know why. I don't know. This is just relatively new.
Yeah.
This is
Yeah. No,
amazing.
it's like pregnancy therapy because every visit they come and they sit in their circle and they have a nice like space set aside for them, and they have music and fun and snacks and relaxation and meditation. It's just a wonderful way to get care.
Wow.
Mhm.
That's awesome. Thank you so much for sharing that. I'm
Yeah.
so glad that that's an option. Yeah, you've heard it for those of you who are watching. And please, by all means, those who could find this useful, for those of you who are watching live or replay, simply forward this so people know to look for these things as they plan for their pregnancy journey. There's nothing like a tribe or a support group for every phase, especially during pregnancy. So I'm glad that this is an option. Now, Doc, having said that, I know people are wondering, man, I like this doctor. This is awesome. And she has a practice that does this. Where can people find you, either to connect with you, have you come speak at their platform, or just reach out to you, Doc?
Yeah, so our website is the epicentercharleston.com. We also are on Facebook, Dr. Kenosha Gleaton, as well as Instagram. And yeah, we are taking, like I said, we're in Charleston, South Carolina. We love taking new patients, and we would be happy to see anyone in the area.
Awesome. And I'm putting all that information in the comment section. I'm going to try to put, let's see, you're also on. We put all that here so everybody has that. So I put it at the bottom of the screen and in the comment section so people can connect with you. But thank you so much for doing this. I appreciate you, sis. This is good.
Thank you. Thanks for having me.
It's like I'm so proud of you. This is beautiful. Like what you did, the last thing you shared. Oh my gosh, that is amazing,
Yeah,
amazing.
it's a big deal. So,
I can't hide my excitement. This is good. This is good. All right. Thank you all for watching. Those of you who watch live, those of you who watch in replay, please subscribe to this channel. And if you or anyone you know is looking for an awesome, a thorough, and a compassionate family physician who have conversations like this to help you live long and well. I am she. Have a good one, everyone. Thanks again, Doc.